Today we're going to be presenting our solution on chronic pressure ulcer wound sites with our scaffold that's made of cross-linked collagen and PLLA skin scaffolding. My name is Brittany.
I'm Ben.
I'm Allie.
And I'm Franklin. So the need for our product is pressure ulcers are caused by lack of blood flow in the area, and these wounds also cause infections that delay the healing process. About 3 million people are affected every year, and around 11 billion is spent treating these patients. Spinal cord patients and elderly are most likely to deform these pressure ulcers, since some of them are unable to move on their own and will need some extra help. We want to prevent infections, reduce hospital time and readmissions, and also reduce the burden on the nurses. Our targeted clients include surgeons, dermatologists, healthcare professionals, and nurses.
Our product will feature Collagen-1 and PLLA, which provide the strength component, and Collagen-3 and elastin, which provide the elasticity to our scaffold. Combined, these components will help to redistribute and alleviate the damaging forces caused by pressure on the ulcer site. Now, in addition to this, our scaffold will also be seeded with growth factors and antimicrobial nanoparticles. The growth factors included will be vascular, fibronectin, and other endothelial growth factors, and they will help to promote angiogenesis and cell colonization of the wound sites. In addition to this, the antimicrobial component will be distributed throughout the scaffold, as the scaffold is naturally replaced by natural dermal tissue. The scaffold antimicrobial components will be released, helping to prevent infection at the wound healing site. Now, to cap this all off, we have a semi-permeable silicone membrane on top, and this will mainly help to seal in the moisture for our scaffold.
At the moment, our product has several complications ahead of it. Such include difficult FDA passage, as well as semi-natural or semi-permanent unnatural tissue alteration. At the moment, our product will be expensive due to a lack of mass manufacturing of our product and our reagents that will be used to create it. However, there is a $9 billion industry devoted for the treatment of pressure ulcers. So if the mass production is put in place, then our product could be made more affordable. Our product will, in contrast, have many benefits for the public. We are designing it to be acellular, which will allow it to have better shelf life for hospital settings. And we are planning to make it very easy to apply to the patient, so this will decrease the amount of time nurses will need to spend towards these pressure ulcer patients, and will increase the amount of time they will have for critical patients. In the end, our product will allow for better healing and increase the health and well-being of the patients it is being used for.
So why would you want to use our product over other products? Typically, autografts can be used to help with the wound sites and to help healing from the pressure ulcers. However, this creates a second surgery site, which increases risk for infection, and our product would not have that problem, so that helps that. Dermagraft, Halo Matrix, and Telemed are all good devices and scaffolds. They work, however, ours is better. It's very easy. It doesn't require a lot of training like these products do. These require taking it out of the package and maybe putting it through saline washes, maybe defrosting it because it was frozen before. We don't have that. Ours is very simple. You just take it out of a box like you would a bandage. You take off the flaps and you apply it to the patient. It's very easy. It's straightforward. Plenty of people have applied Band-Aids to them all the time, so this is not something new that requires training on the nurse's part. Our biggest competitor is Integra, and they have a collagen silicone adhesive wound dressing like ours. However, we have PLLA to help back it up and to make it more structurally sound. So it would help distribute the pressure better, and it helps hold itself up against the skin and creates a better scaffold.